Oncoplastic breast surgery, it's got the word onco in it and plastic. And onco is cancer and plastic is cosmetic or aesthetic. And so oncoplastic breast surgery is where you combine the very best of cancer surgery with the very best of cosmetic surgery, so that a woman who's having cancer surgery can end up with a breast that still looks good. In the past, women didn't always have access to oncoplastic breast surgery, and sometimes their breast could be left looking quite deformed. And that was very difficult for women, particularly women cured from their breast cancer, because they were left with that deformity for the rest of their lives. So now we try to combine the best of cancer surgery and the best of plastic surgery. And increasingly, most breast surgeons and most hospitals can offer this type of surgery, because nowadays most breast surgeons are dual trained in breast surgery and breast plastic surgery. In the past, most breast surgeons were general surgeons, but now most breast surgeons are trained specifically to be able to offer this type of oncoplastic breast surgery. Reconstructive surgery is slightly different. It generally refers to when a woman has had her whole breast removed. So oncoplastic surgery refers to when you are just removing part of the breast and you're trying to reshape it and keep it looking good. But reconstructive surgery is generally referring to when a woman has had the whole breast removed and you are replacing it. And so you may replace it with an implant or with a woman's own tissue, for example, from the spare tissue from the lower tummy or lower abdomen, or sometimes the spare tissue from the back. So it's all reconstructive surgery, but the oncoplastic surgery tends to mainly refer to when you are just removing part of the breast, and the reconstructive surgery tends to mainly refer to when you are removing the whole breast and replacing it. It can do, and that's determined by many different factors. And sometimes a woman wants to reduce her breast volume as part of the procedure, and so you might actually operate on both breasts. Coming back to matching the breast volume, it very much depends on what we need to do to treat the cancer and a woman's preferences. And that's something an oncoplastic surgeon should discuss with the woman at the consultation as to what she wants to get out of her breast surgery. And so much of the discussion is around a woman's preference, particularly when you're talking about replacement of the breast. Do you want to match your other breast, your natural breast, or do you want to change the shape and size of both of your breasts? So this is usually quite an involved discussion that we have with our patients. Breast surgery can take from as little as 30 minutes, that's probably about the shortest operation that we could do, to anywhere 8 hours, 10 hours if you're doing major reconstructive surgery. This is normally where there's a breast surgeon and a plastic surgeon working together to replace the breast using the tummy fat from the lower abdomen. This is called diet flap reconstruction. And this requires the joining of 2 small blood vessels. And that can take up to 10 hours if you're doing both breasts, for example. So it can be as short as 30 minutes, it can be as long as 10 hours. We can reassure women that we do take a break. We don't operate continuously for 10 hours. And it's normally a team of surgeons that's working. So the consultant will be doing some of the more technical, complicated parts of the surgery, and then they might take a rest break, they might go and have some food, whilst one of the younger surgeons will be doing perhaps one of the less technical parts of the surgery. So the surgery continues, but we do take breaks. And all the time that a patient is on the operating table, they are constantly looked after by the anaesthetic and the theatre team, who are absolutely crucial to safe surgery. Because when we're operating on somebody, we're completely focused on the operation. And so it's the anaesthetic team that's looking after the head end and the breathing end. I think many people would be surprised at how many individuals there are in an operating theatre looking after them. There's a lot of people in the operating theatre because you've got the surgical team, because it's never just one surgeon. You've got the surgical team and the consultant is heading up that, but you may have 2 or 3 consultants in a big operation. And then you've got the younger surgeons helping them, and then you've got the anaesthetic team, and then you've got the theatre team with all of the nurse specialists and the theatre nurses. So it's a large number of people. Yes, and we alluded to this in some earlier questions about the recovery from breast surgery. But if you're having oncoplastic surgery or reconstructive surgery, it tends to be slightly more complex surgery. And so the recovery may be a little longer because you may have had a longer operation, you may have had more bleeding, you may have more scars. And so if you've lost a little bit more blood, you may be more tired for longer after the operation whilst your body recovers. If you've got more scars, it may take you a little longer to recover because the more scars you have, there may be slower wound healing and sometimes you get more infection. And so, but generally, most women from most straightforward oncoplastic surgery, by about 2 weeks, they're ready to leave the house, come to the hospital, go out for a coffee with friends, possibly even drive. Breast cancer is hard for anybody. Being diagnosed with cancer is hard for anybody. But one of the things that modern breast surgery can achieve is to leave somebody looking intact. And that's so important because body image is important. And a lot of people say to me, you must think I'm being vain. And vanity has nothing to do with it. How we look is so important to all of us. And it doesn't matter what culture you come from, what society you come from. It does not matter if you cover yourself completely. How you look to yourself is really important. And you don't do this oncoplastic surgery or reconstructive surgery for anybody else. You do it for yourself because it's how you feel about yourself, and that's not vanity. And you can see I feel quite passionate about this because it's so important that people feel good about themselves and that they do not feel mutilated or deformed by their cancer surgery. My job and the job of other cancer surgeons is to see the future and to see the person beyond cancer and make sure that they get back to a fully adjusted normal life beyond their cancer. And this is where you start to see the success stories, because I see women 2 or 3 years later when they're recovering, and the psychological recovery from this type of diagnosis and surgery can take 2 or 3 years. The physical recovery, and actually when we were talking about recovery, I didn't really talk about the psychological recovery, because the psychological recovery takes much longer than the physical recovery. And I think as doctors and as nurses, as healthcare professionals, we're really good at focusing on the physical recovery, but we're not always so good about talking about the emotional and psychological recovery, which takes place at home, behind the scenes, often in private. And I think we're getting better, and women are getting better at expressing how they feel about the emotional and psychological recovery. And I think that's something now that we're all getting better at as a society, is talking about our emotional health and our mental health. But one particular success story that I will never forget is, well, actually there's lots, but one that always sticks in my mind is an older lady. And she had enormous breasts, and her breasts had been a burden to her all her life people had laughed at the size of her breasts. She had to wear clothes that covered her whole body to hide the size of her breasts. And so as part of her breast cancer surgery, I said to her, well, why don't we reduce the size of your breasts to make them more manageable for you? And she was a lady whose bras had to be custom made in special shops. And she had great big dents in her shoulders because of the weight of the bras holding up her heavy breasts. So we removed her cancer, and we removed nearly 2 kilograms of extra tissue from both breasts. And I've never forgotten when she walked into my clinic about 4 weeks later, and she was laughing and smiling, and she said, I bought my bra from Marks and Spencer's. That's the first time in my life I've ever been able to go into a shop and buy a normal bra. And that operation for cancer completely transformed her life overall. It was quite amazing. And I think that's what good quality breast surgery, oncoplastic breast surgery, can achieve. And that's very important. Another wonderful example is a woman who was very proud of her breasts because, as she said to me, these breasts have fed 6 children. And I know that the shape and appearance of my breasts is not what is regarded as beautiful, but they're my breasts. And they have fed and nurtured 6 children who I am proud of. And I want you to keep my breasts looking the same. And so working with the plastic surgeons, we replaced her diseased breast to match her other breast perfectly. And so that allowed her to move forward. So these are the sorts of success stories. It's working with women to achieve what they want. And everybody needs and wants something different. And so women need to be honest about what they need and want so we can meet their expectations. And then we can create a success story for each individual woman going forward.